Hi, everyone. Welcome. Amanda, is it okay if I get started? All right. Good afternoon, everyone, and welcome to Hawaii Public Health Association's National Public Health Week event. My name is Trisha Kajimura, President of HPHA's Board of Directors. National Public Health Week is a time to recognize the contributions of public health and highlight issues that are important to improving our nation's health. The American Public Health Association develops a campaign around National Public Health Week each year. This year's theme is Public Health is Where You Are. As part of this national celebration, we're excited to bring you all together for today's event on an important and timely topic, cultivating Hawaii's public health workforce. Much of that workforce is represented in our membership and here right now. I think we can agree that there are many strengths, but also many concerns about meeting the needs of our community. On behalf of our board and program committee, we hope that today's discussion can help each of us gain a deeper understanding and give us ideas to build on. We're trying something new with our Zoom format today. We're using webinar mode. Your cameras and mics are off, but please feel free to get active via chat and with the reaction emojis. We will be monitoring the chat for your questions for presenters. They can also go in the Q&A feature at the bottom of the Zoom screen. We'll be using your questions for the Q&A with our panel. Can you advance the slides, Amanda? Thanks. This is our agenda. And that brings me to our mahalos. First, I'd like to say thank you to Amanda Martinez from Mental Health America of Hawaii for all of her work with the program committee to put together today's program, and our other program committee co-chair and today's moderator, Stephanie Moyer. Thank you also to the members of the program committee for their contributions. We couldn't do this without our sponsors. At the kupuna level, Hawaii Health and Harm Reduction Center and Mental Health America of Hawaii. At the keiki level, Hawaii Public Health Institute, Minute Medical, Pear Suite, Social Marketing Hawaii, and the University of Hawaii at Manoa Thompson School of Social Work and Public Health's Office of Public Health Studies. We also want to thank our organizational members for their ongoing support. Here's our list of organizational members. Thank you to all of our individual members out there, and if you're not a member yet, please consider joining us. Feel free to reach out to me or our Executive Director, Holly Kessler, if you have any questions about membership. Next, I'm going to turn things over to Dr. Jillian Dunn from our board and our Student Fellowship Committee to share an announcement. She will be followed by Stephanie Moyer and our panel presentation. But before we do that, let's take 2 minutes to create together with a simple word cloud. Follow the instructions on this slide to answer this question in just 1 to 3 words. What does public health mean to you? I'm going to give you a little time to get that started. Here's the instructions and the link in the chat as well. Going to put all our energy into this collective effort. Hopefully it brings us together and sets the tone for our presentation. 1 more minute. All right, we're getting some words here. Community, equity, protecting, well, love, collaboration. Awesome. Access, safety. There we go. Progress, resiliency, harm reduction. Yes. Awesome. Well, we will share the final result of this with you. It'll be a memory, a little memory from today's event. So thank you so much for being here and spending this time with us. We're really grateful for all of you. And next, I give you Dr. Jillian Dunn.
Thank you, Tricia. That was a very nice word cloud there. So the announcement that I would like to make is about HPHA's new internship program for students. This is an opportunity for undergraduate and graduate students in public health programs to learn about how boards work by working very closely with the HPHA board, and also to contribute by participating in the events that we put together. So for eligibility, it's open to any student with a career interest in public health who is currently enrolled at any of the UH campuses, HPU or Chaminade University. It's for 1 semester, and the student attends the general board meetings and also those meetings of a committee that they are interested in, and also works with our events committee to help plan for annual meeting, or in this case, in the spring semester, National Public Health Week. So the application is on the HPHA website. It's pretty quick and easy. It's a CV, an unofficial copy of your transcripts, and a short essay. For fall 2022, the application is due by April 30th. And I should also mention that there is a $500 stipend attached with this internship. So we hope to hear from all our undergraduate and graduate students who would like to partake of this opportunity. And please do spread this information to any students that you might be in contact with. Mahalo.
Thank you, Jillian. So as Tricia mentioned, my name is Steph Moyer, and I am a board member for HPHA, as well as co-chair of the programs committee, along with Amanda Martinez, who is busy behind the scenes. I will be serving as your moderator for today. And as a quick reminder, we will be doing the questions and answers at the end of the panel. So for now, please feel free to drop your questions into the chat or the Q&A box at the bottom of your Zoom screen. So without further ado, it's my honor to introduce you to our first speaker, Michelle Tagorda-Kama. Michelle is a faculty junior specialist with the Office of Public Health Studies, Thompson School of Social Work and Public Health at the University of Hawaii at Manoa. She works primarily as an academic advisor, supporting prospective and current public health students. Michelle is a longtime HPHA board member, starting her journey as a student representative board member and continuing to her current role on the HPHA Executive Committee. So now I'd like to turn it over to Michelle.
Aloha, everyone. Thank you so much, Stephanie, and for all of the coordinators of today's event. Really excited to be here with you all. As Stephanie mentioned, I've participated in engaged Hawaii Public Health Association for many years in my educational journey and into my journey as a professional. So I really appreciate the work that my fellow board members and all the different professionals that have engaged with the board and the association over the years. So it's a really neat opportunity for me to be able to be on this call today to share more about the work that we are doing at the University of Hawaii at Manoa to meet the needs of the public health workforce in Hawaii and beyond. Happy National Public Health Week to you all. I know there's a lot of work that you all are doing in COVID times, as well as beyond, in addition to our day-to-day work. And so it is a nice chance for us to get together to really celebrate all of your work and really continue moving forward as we learn the lessons and learn from the lessons these past few years, and realize there's a lot for us to continue collaborating on and move forward in partnership together. I did want to also extend a welcome message. Our interim dean of the Thompson School, Titine Centel, wishes she would be here today, sharing this information with you all. She is attending a leadership summit for the Association of Schools and Programs of Public Health, but she wishes you all well and is thinking about you all. And again, just wanted to take a brief moment to say that her thoughts are with us during today's event. Okay, so for today, what I will be going over is just briefly some information about what we have seen in the workforce, impacts of COVID-19 on the workforce, and then providing an overview of the work that we're doing at the university, and also want to celebrate the partnerships that we've had and really lean on you folks to share with us what are the different ways that we can continue to build this workforce. What are the skills, knowledge, things that you find valuable in our graduates and future graduates that we can continue to build into our programming. So as Tricia had mentioned in the welcome, please, I encourage you folks to engage in the chat throughout my short talk. I'll be asking some questions and really encourage you all to engage in the chat with your thoughts as well. As we all know, there has been many challenges during this COVID time, and we've seen these challenges in health as well as across the systems that impact health. So we've seen impact in our rural communities, in the education system. We've also seen a big toll that's been taken on different populations within the state. Our mental health is something that we are constantly talking about and have seen an impact on based off of this events during the pandemic. And we've also realized there are systems in place that it's really important for us to take the time to think about what can we do better. And many of us in our respective organizations really rose to the occasion to highlight these struggles, these systems that have been broken, and saw that it was an opportunity for us to fix those things. Other challenges we've seen and became more evident is this underfunding of public health infrastructure, and realizing there's this strain even before the pandemic that we've realized has heightened. A lot of needs that we realize have not been met and continue not to be met. And so more so additional advocacy and support is needed to move forward and beyond this pandemic and really support our workforce in many different ways. And we're seeing, and I know many of us resonate with this too, all across public health sectors, many of us are wearing way too many hats, juggling way too many balls, and we've had to multitask. We had to meet these gaps and meet the needs, and naturally many of us are overwhelmed, right? Those of us working in public health had to meet different roles and wearing multiple hats to meet different roles. And so we've been seeing a rise in stress and burnout, not just locally, but across the nation. Many of us really see the importance of our work. So you'll see a lot of us believe in the work that we do, and that word cloud really was a true testament of that, of what public health means to us, what public health is, and it's community, it's resiliency, it's diversity, being able to serve our communities, achieve equity in health in different ways. So the work that we are doing is very important. We're also realizing that it's stressing us out, it's burning us out. So we really need to be mindful of what we can do moving forward, how we can support our workforce, how we can continue to support one another, as well as the pipeline in training those going into the workforce as well. So I know it's a lot of things to think about, a lot of struggles that we have, but there's also great news from our work and the past few years and our lessons from this pandemic as we move forward, the pandemic really highlighted what we do. More and more people are familiar with public health, the role of public health professionals, the important role we play in addressing different health issues. We also realize how we are all connected. You know, many of us had to develop these partnerships, work collaboratively, learn from each other as we navigated through these new struggles when faced during this pandemic. And we realize how systems are all connected and how we depend on these systems to work for us to be able to move forward and support one another in the work that we do. And because the pandemic has highlighted what we do and public health has become part of, has come to the forefront, there is now this growing demand in public health as a career. We're seeing that locally as well as nationwide. More interest has been generated in public health programs, and students are really sharing their excitement and motivation to want to play a role, want to be able to give back and serve and be part of the solution during this pandemic, but also beyond. And so lots of this interest is we're seeing on our campus. So our undergraduate public health education is one of our, we've seen is one of the fastest growing undergraduate degrees that students are choosing. And we're expecting a continued growth. So this is the number of our students enrolled in our program, in our undergraduate program at UH Manoa over the past few years. And so we're excited to see more and more students exploring the field of public health and wanting to gain the skills, knowledge, and competencies to give back to their respective communities. So public health at UH Manoa, broken down in numbers, and a chance for me to be able to just highlight really briefly the different programs that we offer. So we offer programs at all levels of bachelor's and master's, our graduate degrees, as well as our doctoral programs. So our master's in public health offers 4 specializations: health policy and management, epidemiology, social and behavioral health sciences, Native Hawaiian and Indigenous health. We also offer a master's of science in epidemiology, as well as 2 doctoral programs, 2 pathways, one in public health as well as in epidemiology. And so we're excited because a lot of the training that occurs on our campus prepares students to really apply the skills that they've gained in different ways. And so we're excited that even starting off at the undergraduate level, students are really excited about just taking our Intro to Public Health class, learning about what public health is and using that to help inform their academic journey overall, and really thinking about public health issues, community health issues, population health issues. And so we're positioned in a way to really support that and really look to you folks to help us in shaping the training that occurs on our campus. Our students really are the cornerstone of our program. They really teach us a lot as well. They bring with them many strengths from their lived experiences, from their communities, from their upbringings and who they are and what they value. And so we're seeing a lot of students voicing their concerns during this pandemic, playing a role in sharing their critical perspectives, and beyond the classroom, being able to play a part in the solutions as we move forward through the different public health issues. And so yes, students teach us many things. There are a lot of opportunities for students to be able to make their academic experience their own. And I think that's really helpful for us to have that partnerships within the community where students can go out and have a fulfilling field experience, be able to already see themselves as future public health professionals, work alongside their mentors who are doing great work already. And so we really appreciate the commitment of many of you who have served as mentors, and many of the organizations who have hosted our students then bring back what they've learned and the knowledge that they've gained in the field to just many of us. And this is where I wanted to pause and ask one of my first questions. And I really, again, encourage you folks to engage in the chat because we'd love to hear from you folks as I'm talking about students and what they gain and what they bring to our programs. we also want to really think about our students once they graduate. What are the things they're bringing to you, bringing to the organizations that they hopefully are employed by and continue to work with. So my question for you folks are, what skills are most valuable for public health graduates to have? And I'll go ahead and put that question in the chat. Again, what skills are most valuable for public health graduates to have? And really encourage you folks to share your thoughts. And this is something I'll be able to take back to our department, to our faculty, and help us in continuing to think about our curriculums and shaping that to, again, meet the needs of you folks as those that will be hiring. So in a way, this is also learning about what the workforce needs are so that us as a higher education institution are able to meet those needs. So thank you folks for sharing already. So I'm seeing health policy awareness, cultural sensitivity, quantitative skills, fund development, grant writing. Wonderful. Really appreciate all of that, and continue to please continue to share your thoughts. I know we also have great graduates. I see alumni of our program, so thank you for weighing in. We appreciate that. So yes, continue to share. This again will be helpful for us in our work teaching and mentoring our students. So thank you. Yes, systems thinking, strategic planning. Wonderful. Okay. And so we are also building new pathways. So I wanted to take some time to just briefly go over some of the new things happening at the university. So this is the first year we are offering a community health scholars summer program. So as I mentioned, public health is now at the forefront for many folks, or it's something that they're talking about and wanting to learn more about. So we're hoping to start this engagement with the high schoolers. So high school students from across the island are able to apply for our summer program. So juniors, seniors, and incoming freshmen to the university, so high school juniors and seniors will get a chance to learn about what public health is through our Intro to Public Health class and through this summer program. We'll also have an additional summer program for our current students interested in Native Hawaiian Indigenous health. And so this is building the pipeline now into our graduate studies. So current undergraduate students can learn about Native Hawaiian and Indigenous health issues and topics, as well as gain the preparation and build their backgrounds and readiness for graduate school. So working on supporting different populations of students along the way. We also are just wrapping up our recruitment for our first online master's degree cohort in public health. So they will be beginning in the fall semester, and so the specialization of health policy and management. So this program was launched to meet the needs of folks in the Pacific, as well as our neighboring islands. It was created in response to workforce feedback and wanted to, we saw this as an opportunity to accommodate the working professionals. So having this online program would meet provide an opportunity for our working professionals. And then we've also, in the past few years, created some new classes focusing on One Health and continuing, again, our work and commitment to the community by discussing Native Hawaiian health issues and determinants. So just some of the highlights of things that we've been doing, some new programs we want to share with you all as we work on developing our workforce needs and addressing our workforce needs. So at the Office of Public Health Studies, we also have health equity at the center of a lot of our work, and we have 4 strategic areas that really help us to think about ways we can meet the needs of our community. So focused on Native Hawaiian and Indigenous health, oceans and human health, Filipino and immigrant health, as well as epidemiology in the Pacific and beyond. So there are different collaborations occurring and partnerships being created for us to achieve health equity through these strategic focal areas. So there are some program ideas that are just starting. These are not things that are in place, but more just in the starting points of some dialogue. We recognize we're in this pivotal moment of addressing workforce needs. And so these are just some ideas that we have been in discussion at the university at both the Thompson School level as well as the system level of ways we can really think about what the workforce, how we can meet the workforce needs and what will that workforce look like. And so we really encourage folks to share your ideas of other ways that we can strengthen our workforce training, our pathways to support our graduates into the once they leave the university. And so some ideas of what's coming or things or potential ideas. So trying to build in fellowships post practicum or once they've graduated to help prepare our students to transition to different positions. We want, thinking about better alignment of qualifications for hiring of public health positions. So working more closely with government jobs to make sure that what our students are graduating with really align with those needs, and so that we can continue to build that pipeline and streamline how we can move students from our programs and into the workforce. At the system level, there's conversations about having a University of Hawaii liaison who can link students to different opportunities. And so that's at all levels. We have our community health worker programs, training at the community college, as well as programs across the system that focus on public health. So really being able to have someone that can map these needs, be mindful of what these needs, and then intentionally connect those needs to the programs that will provide students to fit those needs. And so again, we encourage you folks to help in thinking about ways we can strengthen our pathways for students to get hired, and thinking about what would be useful for all of you as potential employers of our graduates. We welcome your ideas as well to help us in strengthening our students in the pipeline into your organizations. Okay, and so partnerships is really important for us, right? We can only do this work at the university in this training of our students because of these partnerships, because we're able to build these relationships and cultivate these relationships with all of you. So we thank you for being able to partner with us as we do so much of this work together. And so that's something that we encourage, that continuation of ways we can learn from you and how we can collaborate moving forward. So as we move forward beyond COVID times, we want to do it right, again, in meeting the workforce needs. And we want to continue to build those new relationships and foster the ongoing collaborations that we're so fortunate to already have. So a call to action for all those here and for colleagues that are not able to be here today, but we encourage you folks to share your thoughts too. What can we do to support your work, and how do we continue to meet the needs of public health capacity? So as we move beyond COVID times and recognize there might be additional skill sets that were needed, or if there are additional hiring needs that you see, we already see a strained public health workforce. And so we want to play a role to make sure we can meet that capacity. We can graduate our students to be able to meet that demand that we see in the community. So another question that I'd like to pose, two questions here. So what can we do to support your work, and how do we meet the demands of public health capacity needs? So I'll go ahead and put that into the chat. I see a lot going there, so I'm so sorry I haven't been able to track all of them, but we definitely will be able to save the chat and follow up with you all. And so we encourage you to stay in touch with us. And this is only the beginning of a conversation, again, for us to move beyond COVID-19 and continue to meet the workforce needs. So yes, feel free to share your thoughts as we move forward, and what can we do as we move forward in COVID times. And then as I close out here, I know some of you folks, again, as I mentioned, I could see some familiar names, are alumni of our program. So we're continuing to meet the needs of the pandemic and beyond, and public health at UH Manoa has been around for many years. So kind of in celebration of National Public Health Week, a few photos here from memory lane of our past classes within the School of Public Health and now Office of Public Health Studies. And so we really encourage you folks to continue the collaboration, keep in touch with us, and we'll do the same in learning from you all on how we can continue to build on public health in Hawaii, build our workforce moving forward. So I'm just gonna take a really quick look at the chat here. So conducting training, need assessment, and engage stakeholders on capacity development. So it'll be great to hear also, in addition to what you folks have all shared here today in the chat, what are those additional training needs look like, and whether or not the university can provide those trainings in different ways. We need more public collaboration with all of our public offices, businesses, and organizations. And so, opportunities to be able to be the venue or be that bridge to be able to help those collaborations flourish or begin. So, well, appreciate you all for the time. So thank you, mahalo agyamanat. And so I will encourage you folks to continue the conversation in the chat. And we'll definitely follow up and look forward to chatting with you all more about your ideas of how we can move forward beyond this pandemic and supporting our workforce needs. Thank you.
Thank you so much, Michelle. Our next speaker today is Rie Kuhaulua. Rie is the Research and Development Specialist at the Hawaii Public Health Institute. She has 20 years of experience in public health and mental health in the US and Pacific Islands. Rie holds a Master's of Public Health from the University of Hawaii and a Doctorate of Psychology from the Hawaii School of Professional Psychology. So without further ado, I'd like to turn it over to Rie.
Hello, good afternoon. My name is Rie Kuhaulua from Hawaii Public Health Institute. It's HPHA, HPHA, or HPHA. And thank you for this opportunity to share my thoughts on the importance of internships. Today, I wanted to share who we are, what we do for internship, and highlight some of the importance of internship for both students and the host organization. Next slide, please. HPHA is a statewide public health organization. We improve policies, systems, and environment through advocacy, education, training, research, and capacity building. We foster partnerships with organizations from various sectors. So in short, we connect people, organizations, and resources together around an issue. We convene coalitions, and we act collectively as change agents. Next slide, please. HPHA convenes many coalitions that focus on issues like tobacco, ESD, drug, alcohol prevention for youth, oral health, healthy lifestyle, school-based food systems, food access, kupuna health, and COVID-19 response. We also delve into workforce development. HPHA is committed to advancing public health workforce through training, coalition building, and mentoring of students. So our public health training hui, for example, offers free monthly webinars. The Hawaii Community Health Workers Association advocates, trains, and offers networking opportunities for community health workers in Hawaii. And finally, our internship program provides practicum and long-term placements within HPHA. So in short, workforce development is one of our core parts of our organization's work, and it's a big priority for us, considering that Hawaii's public health workforce is diminishing, especially over the next few years. So we really love working with students. Next slide, please. When we say internship, we include a broad range of training types. For example, we include more short-term learning opportunities such as practicums or externships, but we also mentor long-term, time-intensive internships, and that's traditionally called an internship. So for Hi-Fi, the purpose of an internship is for the students to gain experiential learning opportunities, networking opportunities, and mentorship from our staff as well as our partners. We use service learning spectrum to distinguish between an intern and volunteer. So the most simplistic distinction here is that interns are learners. We hope they could learn and practice public health knowledge and skills, or maybe they want to gain more experience in the field. Whereas volunteers are students who provide service. So they generously share their talents, their skills on their own time. So very simply put, interns are learners. And we offer internship to students from a variety of levels. And the goals are a little bit different depending on the educational level. So for example, our high school students, particularly juniors and seniors in high school, they will intern with our tobacco or drug alcohol prevention or food youth councils. And what they do is they get trained in the policy and advocacy process. They go ahead, select their policy priorities, and they become change agents. They educate their peers, they go into communities to advocate for a certain policy. And our hope is that they would choose public health or health-related fields, or maybe STEMs or other related fields as their majors when they go to university. And we hope that they'll be future leaders within public health in the future. So leadership is a big part of high school training. For university, undergraduate, graduate, and recent graduates, which are 1 to 2 years after graduation, we welcome them to join our general internship program. And we hope that by the end of their internship, they join the public health workforce, or they go for their further education, or they're just testing out to see if public health is a good fit for them if they want to continue on in the field. We do get a lot of students from like kinesiology, physical therapy, medicine, all kinds of different disciplines, and they want to learn more about public health work. Finally, we also mentor community health work certificate program students, and they work specifically with our Hawaii Community Health Workers Association and work in coalition building and community skills. Next slide, please. Hi-Fi interns and supervisory staff follow learning plans that they outline. So these learning plans include learning objectives, activities, and outputs, so deliverables. These learning plans are developed through a collaboration between the intern and our staff. And interns work on their projects. For example, the most common project we find is the education and advocacy skill building. We also have a lot of internship positions for coalition building and policy program development, as well as more analytical and technical skills like assessment and research. The images that you'll see in the next couple of slides are all, some of the projects that our interns helped us with. Next slide, please. So our work becomes more visual and technologically advanced. So we really appreciate interns that bring in creative skills with them to their internship. This is like, you know, using social media or media skills, graphic skills to learn how to message and to present clear messages to the populations that we want to access. Next slide, please. And on your left-hand side, you'll see more past interns projects. So what is the importance of internships? So first of all, internships are experiential learning opportunities where students can learn and apply public health knowledge and skills. So they're here to learn. At Hi-Fi, we want to create a culture of learning. So instead of focusing on tasks to complete, we create learning plans. So there's a clear learning process for them, a developmental process for them. But we also offer opportunities for one-on-one training with our supervisors, as well as more formal types of trainings that we hold. And we'll talk about a little bit about that later. Second, we provide networking and relationship building opportunities for students. So internships can help students to observe and participate in coalition meetings or meetings with other staff members or partners. We also encourage students to, designate us as their reference, but we also want to develop a relationship so we can understand their strengths and challenges and maybe match them up with a job that comes up. And students can really learn about how complex the public health system is just by sitting in some of our coalition meetings. So we really want interns to learn how to network and reach out and work with people. Thirdly, internships provide opportunities for public health professionals to mentor students. Now, mentoring just goes beyond the typical short-term project supervision and training, but it really includes long-term guidance, personal and professional development. So internships can help students develop or revise professional goals. For example, whether they want to choose public health as a career or decide on getting another degree or specialized training. So we really want this opportunity for them to learn and to explore. Next slide, please. Another important factor is professionalization. So this is like students having the opportunity to learn about being a professional, learning professional norms, organizational cultures, how we interact professionally, how we communicate, how we follow professional ethics, policies and procedures of our organization, and so forth. So we try to mimic the professional process by having students complete application forms, orientation, reviews. They join our staff meetings, and they're part of our family. Internship is not necessarily a work experience. It's a training position where students can build confidence and develop portfolio of their accomplishments so they can show it to their future employers. So if you're a student, take advantage of your time with an organization, develop strong relationships with your supervisor or the staff, and ask people to be your job reference and take advantage of any training opportunity that you can. Next slide, please. So there are several free training opportunities that students can utilize. For example, the Western Region Public Health Training Center at University of Arizona offer free webinars. HPHA convenes a wonderful coalition called the Public Health Training Hui. They offer free webinars each month for public health and health professionals on a variety of topics. And if you're interested, please visit their website and learn more about their program. At HPHA, we sometimes offer short webinars, mostly talking about the issues that HPHA is working on, such as tobacco, food access, and policy and advocacy. So we typically send information on upcoming trainings to our university partners and interns. In terms of stipend, I think most organizations do not offer stipends, but there are resources available for students who are enrolled in Hawaii-based universities. So Western region, Hawaii, California, Nevada, Arizona, and the Pacific jurisdiction. Yes, so they offer a very limited number of stipends per year, and they do have priority areas where they want to focus on. So please visit their website and read their stipend program information. And yes, we were successful in getting stipends for one of our interns, so we're very excited. Next slide, please. So finally, how can interns transition from internship to the workforce? So as I mentioned, make sure you develop that relationship with your supervisor, ask them to be a job reference, make sure your resumes are great. I'm sure your internship placement would also love to help you out with developing your resume. But also, if you're applying for a job that requires 1 to 2 years of work experience, or you want to go to medical school, or you need service and work experience to go into a degree program, please consider something like a national community service program, such as AmeriCorps, or international service programs like Peace Corps. So, for example, AmeriCorps, you work locally, so you can find sites within Hawaii, and you serve for up to 1 year or even more. And there's different programs within AmeriCorps, like the VISTA, state national programs, and state national program has the public health core right now. There's also FEMA Corps that delves in disaster management, and Peace Corps, where you can go out internationally. And I'm I'm an AmeriCorps alum. So yeah, I really love the AmeriCorps and Peace Corps programs. If you have any questions, you can always ask me about AmeriCorps experiences. And finally, HPHA is partnering with UH Manoa's Office of Public Health Studies, and we're going to hold a public health job fair on May 3rd from 10 a.m. to 2 p.m. at the Manoa Campus Center courtyard. If you have any questions, please contact my colleague, Rosalind at hyphi.org for more information. So thank you for this time. If you have any questions, or if you're interested in our internship program, you can go to the link there or contact me at rie@hiphi.org. Thank you very much. Thank you, Amanda.
Thank you, Rie. Up next, we have Karen Corona Perez. Karen is a senior at Hawaii Pacific University studying public health. Her goals are to be able to improve the lives of individuals on a macro level by optimizing all of the social determinants that directly affect the health of a society. She plans to pursue her master's degree in public health upon graduation in spring 2022. And without further ado, I will turn it over to Karen.
Okay, hi guys, can everyone hear me? Okay. Can everyone hear me? Sorry, it took me a while to see the screen.
Yep, you sound great.
Okay. Yeah, hi, I'm Karen. I am a senior at HPU. I'm graduating this semester with my Bachelor's of Science in Public Health. I grew up on the Outer Banks of the East Coast of North Carolina, and I transferred to HPU I began my education at HPU in fall 2019. That time has flew by for me, and I'm just very grateful and honored to be in the position that I am now. Speaking here now, it's made me appreciate my experience with HPU, and the hardships that come with being a student have been worthwhile now. And I'm also the HPHA student fellow this semester, which has been a great experience so far. Oh, next slide, Amanda. Thank you. I want to give you my own personal perspective. So I'll start with saying why public health is important to me. I feel like there's a big emphasis on individual health, and there's a very individualistic culture. And that's not a bad thing. I just think it's what's more common. And I think that there needs to be an equal or maybe an even bigger emphasis on population health and taking care of a society as a whole. And to me, that's what public health is. From a young age, I've always been able to grasp the concept of health, not just in physical health, but all factors that affect health. Kind of like how some subjects like science come to students easily. For me, that was always health. And I can't really pinpoint why or what shaped that, but I'm just thankful for it because I use it to my advantage alongside my empathy and compassion for helping others. So I'm very happy that I can say I I love what I do and I do what I love with public health in my education, and then I'll be able to bring that to my future public health career. Next slide, Amanda. And then continuing on my perspective as a student surrounding the public workforce and public health. I know that the crisis in workforce is a national issue, and as public health students and professionals, we can recognize that a workforce crisis in any career is a public health problem, which is why for me as a public health student, it's important for me to address. So I'll share my perspective on as someone who's joining the workforce soon and has to take into account all the challenges and different barriers that I know I will have to come across as a recent graduate in Hawaii. So first thing is careers. I think that the majority of healthcare happens outside of a hospital, and that is public health, which is the water you drink, the food you eat, your environment, your education, the state of the economy. And that kind of ties into the National Public Health Week topic, which is public health is where you are, because public health is everything. So that means that there's numerous careers, which can be health promotion, health education, research, epidemiology, surveillance, the list goes on with public health. So I just want to highlight that it's important to care specifically that public health workforce is facing a crisis, because there's many careers at stake when there's a crisis in that. And then experience is very essential in the hiring process. I know that as a student, and I feel like that it's more important nowadays, now more than ever. And experience or lack of is one of the biggest barriers, I think, in filling entry-level jobs or just any job. So I think that students, employers, and organizations and institutions and educators all have a very important part to meet this experience requirement. As students, I think that we need to make sure we make the most out of our experience. We get quality experience so that we can carry that over into the jobs that we get into. And then as educators and institutions like universities, I think it's their job to, create that strong relationship and collaboration with other organizations and employers, and integrate that over the years so that, the universities send their strongest students, and that the employers are confident in the students that they're sending. And I think employers and organizations need to allow those internship opportunities to be there for students, because it'll benefit students then, and in the long run, it will benefit employers because they'll have a bigger pool of students with experience. And I know that as a student, I've benefited from my internship opportunities. Last fall semester, I interned at the Kula nonprofit in Papakolea, which is the Hawaiian homestead community. So I got to experience how a nonprofit works from the inside. So it's like compassion and love, but it's also professionalism and drive. When there's not a big budget, you need to get stuff done to help those that you want to help. And this semester with HPHA, I've been able to get a different kind of experience, but just as essential to my development as a student. I've been able to get board experience by joining board meetings. I've utilized my research skills with the survey I created. I've worked alongside a range of different health professionals, networking, which is like today, what I'm doing now. And I just think that it's important to get this type of quality experience to make the most out of your experience with your internship. And then you wanna, I know keeping students on the island post high school graduation and post college graduation is something that Hawaii really needs to focus on, or public health professionals in Hawaii need to focus on. The cost of living has caused the term brain drain, which is new to me, which is when students or professionals leave their home state in order to seek employment or higher education in another state because the cost of living is more sustainable than their home state. And to do that, we should practice our public health promise of education and promotion through trying to get local students to stay at our local universities and more specifically get them into our public health programs. And I think introducing public health to students at an early age, like even just middle school, and introducing them to the concept of public health, because unfortunately a lot of Americans didn't know what public health was until the pandemic. So I think it's important that we teach students what public health is, and also show children the different career opportunities that come with that. And then next is money, wages and funding. Doesn't solve everything, but money definitely helps a lot. And I think that one of the number one things is salary. A lot of the struggles with filling jobs as students is the salary is just not sustainable. And unfortunately, the case that we see a lot is professionals investing their time and money into their education, but they're encouraged to, or in a sense, sometimes forced to either leave the island or pursue a career path with less resistance. And it's sad when we do have the qualified professionals and recent graduates and they have the passion is there, but unfortunately people have to choose a career that's going to help them survive for themselves and for their families. And then this goes without saying, you know, the cost of living in Hawaii, which is the housing and food sustainability that has affected me as a student, and I know a lot of students. So that is a statewide problem. And then when those social determinants of health are aided with funds, that allows the quality of life of public health professionals to improve, and that quality of life is transferred into the quality of their work, and the product of their public health professionals' work is the population of Hawaii. Next, Amanda. Next slide. So that was just my personal perspective, but I know I'm just one student. So I created a survey to ask other public health students in the state of Hawaii what their perspectives on the public health workforce in Hawaii is. So I sent it out to HPU public health students. HPHA helped me send it out to their student email list, and my preceptor, Dr. Kamunia, also helped me send it out to her students. And then these are just some demographics I'll give. I asked where they were from so I could correlate that to some of their answers. A lot of local Hawaiian students and as well as mainland students. Next slide. I had 21 respondents. The majority of my respondents were graduate students. Next was a senior, fourth year senior students in undergrad. And then I had 2 third-year students, 1 second-year student, and 2 other students that clicked other, and I couldn't format it to specify what other was, but so I'm not sure. But the next slide, Amanda. So I also asked what level of confidence students felt in finding a public health job in Hawaii, and the scale was from 1 through 5. The majority of answers were 3 and 4. And I pointed out my demographic of what year students were, because for the level of confidence, the students that had a level of confidence of 4, those were mostly undergraduate seniors, and the students that chose a level of confidence of 3 were graduate local Hawaiian students. The majority of those were graduate local Hawaiian students. So logistically, that's why I want to note that, because I feel like if you are a student in higher education and you're Hawaiian, you should be the most confident. And maybe that's due to the fact that those students have already been exposed to the workforce and they've faced these barriers. That's why their confidence isn't 3. And as compared to the undergrad seniors who have a confidence of 4. They haven't quite yet made it out to the workforce. And then the next slide. And then I also asked students what areas of public health they were interested in, and I won't read them out loud, and these aren't all of them because it was open-ended, but I just wanted to show this list to highlight the point that I made earlier, that there's a lot of careers at stake when there's a public health workforce crisis, because public health comes with many different career opportunities. Next slide, please. And then and then the other questions I asked were open-ended. So the first one I asked was, what advantages do you think that you may have over others when entering the public health workforce? And the majority of responses were experience and having an NPH. Then the other question was, what do you think are the biggest barriers or challenges that you or other students may face when entering the public health workforce in Hawaii? And those were lack of experience, lack of networking and resources, limited job opportunities, and lack of an NPH. And then, what do you think are potential solutions to help build a stronger public health workforce in Hawaii? A lot of students said internship, volunteer opportunities, funding, promoting and educating public health, and then developing strong academic and professional pipelines. And then I asked what would be an ideal starting salary or livable wage for public health professionals working in Hawaii. The lowest answer I got was $37,000. The highest was $80,000. And then most students answered, it was open-ended, but answered $50,000 to $60,000. And then I also asked students, what are some ways that you think would increase student engagement with HPHA? And this goes for any organization as well. So students said collaborating with universities via workshops, career path panels, and introducing the benefits of HPHA early in college, and having membership for students accessible. And I know I went over that pretty briefly, and I can share, and I have more detailed results of the survey for anyone that may want that. But I just wanted to share with everyone that the similar perspectives that myself and other students had surrounding public health workforce in Hawaii, and the importance of our thoughts and perspectives because we're the future leaders in public health. And I'm happy to hear with our previous panelists that a lot of these topics were touched and very similar. So that gives me hope as a student. And that's pretty much it. And I just want to thank HPHA and my preceptor, Dr. Kimonia, for allowing me and trusting me and giving me this opportunity today and throughout my whole semester. And then my HPU professors for paving this path for me, my fellow student peers who allowed me to speak on behalf of students, and the students who took their time to complete my survey, as well as our other panelists and community members for taking the time to listen to our student voices today. So thank you.
Thank you so much, Karen. Last but certainly not least, we have Dr. Diana Felton. Diana Felton is the state toxicologist for the Hawaii Department of Health's Hazard Evaluation and Emergency Response Office. Diana works with many federal, state, and community partners on environmental health issues and currently serves on the EPA's Children's Health Protection Advisory Committee and represents Hawaii as the State Environmental Health Director for the Association of State and Territorial Health Officials. Dr. Felton graduated from the University of California, Berkeley, and attended medical school at the University of California, Davis. She spent many years working as an ER physician and toxicologist in Massachusetts and Hawaii before transitioning to state government work in 2018. So without further ado, I would like to turn it over to Diana.
Thanks, Stephanie. Thanks everyone for having me. I'm just going to share my screen here briefly. All right, hopefully that is visible there, and we'll go ahead. So I titled this portion of the panel, Environmental Health Now More Than Ever. And essentially, I'm going to give a plug for why I think we need to be pushing environmental public health as a top priority in workforce development and other areas of public health. So important to first discuss what we mean by environmental public health. This is a definition on the screen here from the Association of State and Territorial Health Officials, or ASTHO. And it's that environmental public health programs protect communities from natural, man-made, unintentional, and deliberate threats and hazards in the environment. That's a pretty broad definition, but I think does start to encompass things that environmental public health do. So ASTHO put out a policy brief on environmental public health, and they listed a large number of things that environmental public health programs should be doing. So that is on this slide, and I realize that this slide is ridiculous and crowded, and I'm not going to read through all of them, but I really just wanted to make the point that the scope of environmental public health is enormous. And it's everything from public health impacts of toxic exposures down here at the bottom, which is my specialty and area, to infrastructure, to lab capacity, to food supply, infectious disease vectors, environmental emergency response, and on and on. So I'll let you read through a few of these for just a moment. So as I'm up here advocating for expanding environmental public health programs, why now? Why is this so important now? And there's a number of reasons that I identified. The first being that environmental threats are increasing. We're going to talk a little bit more about that in a moment. But there's also a greater understanding and growing knowledge about how health impacts from environmental exposures occur. Environmental health inequity is becoming more clear and more to the forefront of both policy and individuals' minds. And we're learning more and more about how addressing environmental risk factors can improve health for both individuals, for communities, and for populations. And in fact, the World Health Organization recently estimated that 23% of all deaths worldwide are attributable to the environment. And 26% of deaths in children less than 5 years old could be prevented with the removal of environmental risk factors. So that's pretty impactful. Now, getting from A to Z there is another question, but it still highlights the importance of environmental public health and why we need to be focusing and working more in this particular area. So what do I mean by increasing environmental threats? These, whether they're human caused or natural disaster or some combination, the frequency and intensity of environmental threats is increasing. So just here on Oahu or here in Hawaii, a couple of examples from recently. The picture on the top shows the access tunnel at the Red Hill underground storage tank facility, where the releases of jet fuel occurred in 2021 that then got into the drinking water and poisoned thousands of people and caused an environmental catastrophe with huge public health sequelae. The picture on the bottom is a depiction of the track of Hurricane Douglas in 2020 that came very close to striking Oahu, the closest I believe, in recorded history. And these types of events are increasing, and we need to be better prepared to deal with them. And really sort of encompassing a lot of these issues, not always the exact direct connection, but often is the issue of climate change. So this is a slide that's going to depict an overall representation of climate change and its myriad anticipated effects on public health. And we know that climate change impacts a wide range of health outcomes. And this is a slide from the CDC that shows in the middle, rising temperatures, more extreme weather, rising sea levels, increased carbon dioxide, and what intended consequences they will have on public health. So air pollution being a huge one, and what that means for asthma and cardiovascular disease and other respiratory illnesses. changes in vector equality and the spread of vector-borne infectious diseases. Are we ready for more dengue in Hawaii? Are we ready for for malaria to come to Hawaii? Increasing allergens, water quality impacts that might cause harmful algal blooms or impact our fishing supply or spread waterborne infectious diseases, impacts on our water and food supply, environmental degradation of multiple kinds that have a whole series of downstream health impacts. And of course, increasing extreme heat and direct heat related illness, and then severe weather, which is, I think, very obvious to those of us living here in Hawaii and what we've experienced over the last 5 to 10 years in the increasing number of, 100-year floods and storms and get closer and closer hurricanes. So all of these issues with climate change and human health are environmental health issues that need to be addressed, and we need adaptation and mitigation strategies to be able to prevent some of these sequelae from happening. And that's where the environmental public health workforce can really play a role. This is just another infographic. This is from the HPHA and shows similar linkages and health impacts anticipated from climate change. And I must say, when I think about climate change and all the health impacts, I definitely get a very strong doomsday feel. And, eco-anxiety is a true and real thing, but it is quite alarming to think about these impacts. And I feel that we have a very strong purpose and need to start addressing these events before they happen. So moving on to some other reasons why now is the time to expand our environmental public health workforce is this idea of health equity and environmental justice. There's a growing awareness of environmental health inequities throughout the world and in Hawaii in particular, and the importance of environmental justice. We're, more and more there are tools being developed and increasing strategies for understanding how environmental justice and environmental health inequities are impacting people's health. So things like California's Healthy Places Index or the EPA's EJ screen, and more discrete and useful tools are being developed to help us understand how to both identify these areas or situations where there are inequities and then actually act on them. And there's really a need for public health professionals that are trained in identifying and addressing and documenting how environmental justice and environmental health inequities are contributing to complex public health programs. And I think the COVID pandemic really showed us a lot of that, but the scope is gigantic. So what are some of the potential efforts, that we can do to expand environmental public health communities? And I will preface this by saying these are some ideas I have from my perspective working in a state environmental health role, but that I'm definitely not an expert in this area. So I think a lot of the people that have already spoken on the call may have more ideas to add, but I really see the things that would help being training, capacity building, and workforce. So training, one of the things I sort of think about a lot is that I think we need more medical or health training for environmental professionals, and we need more environmental training for medical professionals. Really need to do more of the crossover of these two areas to really have a better understanding and a better ability to both identify, predict, and prevent environmental health threats. So these are just some interesting strategies that people have used. The top is an article about developing core competencies for medical students and pediatric residents. It's very elaborate and extensive environmental health training for those groups. And the bottom is a communications toolkit actually from HPHA that can be aimed at environmental health professionals, environmental professionals, better communicating environmental health risks to the public. So these are just a couple of examples of how training could be improved to better crossover or meet those two areas together. So building capacity, this is something I think about a lot working in state government. We need more staff and more funding. And I know this is not a problem isolated to, Hawaii Department of Health. More people, more time, and more money. That is what we need to make things happen. But, what are the policy changes we could do? Where are the avenues we can reach to encourage expansion of state environmental public health programs, but also those on the federal level, locally in the academic sector and NGOs, wherever they might be. For example, a perfect example is there's no one currently in the Hawaii State Department of Health whose primary job is to work on climate change and health. There's lots of individuals throughout the Hawaii Department of Health that are doing small parts in their little silo, but there's no one coordinating or overseeing the process, and certainly no one with the time or capacity to go out and get some of the current funding that's available to build a climate and health program. So this is something we're really striving to fill this gap. And, fortunately, we've been lucky enough to get House Bill 1842 through most of the legislature, and fingers crossed that we'll be able to have a climate and change health adaptation specialist established in the Department of Health who can really take this role and run with it. You never know what's going to happen in the legislature, especially as it gets into April, but we're very, very cautiously optimistic that we'll be able to have this position. But this was years in the making and a lot of effort into establishing this position, and it's not for certain yet. So these efforts to change policy and build capacity, particularly in a state government level, can really take time and are slow, but they can have pretty significant impact in the long run. So workforce development, to fill these positions and build this capacity and combat these growing problems, we need trained workers, but there are a lot of barriers. And this is a great diagram I found from the National Consortium for Public Health Workforce Development. And, it really shows some of the many things that are needed for public health workers. And there's a lot of people out there and organizations at the local, state, and even larger levels working on this problem of public health workforce development. But I also just wanted to put in a plug that I think it's important to remember that given our unique geography and climate and culture, Hawaii has some really exceptional environmental health issues. And the classic example of that is Kilauea, and volcanic environmental health hazards that we experience here in Hawaii are very unique, certainly in the US, and really even somewhat unique across the world, given the type of volcano and the type of volcanic hazards we experience. So the development of an environmental health workforce that's familiar with Hawaii's unique environment and culture would be very beneficial to the health of the people of Hawaii. So I'll stop there, and I think it is time for questions, and happy to answer any along with the rest of the panel.
Thank you so much, Diana. So I do want to encourage the audience, if you have any questions that you didn't get to type into the chat box or the Q&A, you can go ahead and do that now. The first question that I have is actually for Michelle. There was a question asking if there are any in-person requirements for the online master's program.
Oh, awesome. Hi, thanks for that question. I do want to shout out, there's a number of faculty members and folks from the University of Hawaii on the call, so thank you all for being here. I will try my best. So for our online master's program, there are two required in-person elements. One is orientation, and then one at the midpoint of the program as well.
Thank you, Michelle. So this next question has kind of been brought up a few times, but the question is, how are we encouraging our graduates to stay home to work in their own communities? And I'd like to open it up to all the panelists to provide some feedback on that.
I'll get started and encourage my fellow panelists to chime in as well. I think what would be important definitely is having these field experience opportunities in the community. So I myself am a graduate of the University of Hawaii at Manoa, both undergraduate and graduate level. And having that partnership with the university and community organizations, different coalitions, I think, and Department of Health, I think it's a chance for students to really learn about those issues firsthand and get a chance to be part of that and feel that they can, learn the skills to be able to give back to their communities. And many times, students are leaned on about and see that they're being from the community is a strength, right? Their lived experiences really hold much value that we encourage our students to use that. So one of the things we see is many of our Philippine students with Philippine language expertise and background are, really a role in helping translate during this pandemic. And so that's one of the things we like to celebrate, that, hey, there's a lot of things that you bring forward from your communities, the training that can provide you and can take that back and support in different ways. And I really liked Karen's presentation and her perspective of students sharing their needs about what can we do in terms of adequate compensation, being able to have those kinds of supports for them to stay. So I know that's something we're continuing to be mindful of as well. So.
Did anybody else want to add to Michelle's answer for how we're encouraging our graduates to stay home and work in their communities? Okay, so the next question, and I'm going to try and paraphrase this, but the question was kind of asking, is there a way to communicate the issues that public health majors are encountering with med students and professors? So I guess maybe clarification from who asked this in the chat, but wondering, and I'm hoping I'm understanding this correctly, but are you asking, like, are there similar issues that are happening in public health that are happening at the med school? And if so, how can maybe Office of Public Health Studies work closely with the medical school to see if those needs can be met? Any thoughts, Michelle?
Yeah, I think clarification would be helpful. One of the first things that came to mind, and I was actually thinking about this in Dr. Felton's talk, or Diana's talk, we do interprofessional education at the University of Hawaii, where public health students from the School of Nursing, Johnny Burns School of Medicine, social work students as well, come together and work on key health issues, learn to collaborate and hear from their respective fields. So I think that might be an opportunity for us to bring maybe concepts of environmental health to the forefront, so then that interprofessional training can occur so that we can meet the need in that way. So that was just kind of my first thought about on that topic. Yeah.
Maybe we'll see if that person clarifies. And in the meantime, I wanted to pose a question to Rie. I think that a lot of the folks that are on the webinar today, we might be preaching to the choir, right? But how do we get new organizations to bring on interns in the public health field?
So how to start off a public health program?
Or I guess there's organizations out there that maybe don't currently take on interns. And is there, what can we as public health professionals do to encourage new organizations to take on interns to give more exposure?
Sure. So we have a little rule that staff needs to have projects that are appropriate for interns, and they have to have time to mentor the students. So if those criteria are not met, we do ask our partners if they're open to either co-supervising or to take on the students. But the best way to start really is work with a student, just one student. It's trial and error. and try to find your own style, your own way of training students. Yeah, so it just takes time to develop that mentorship skill.
Great, thank you. So I do want to acknowledge the time, and I think we're going to wrap up. So I just want to give a big mahalo to our 4 panelists. So thank you so much to Michelle, Diana, Rie, and Karen for joining us on the webinar today. I'd also like to give a big mahalo to my co-chair, Amanda Martinez, who is behind the scenes and working super hard on Zoom. So thank you to her, as well as a big thank you to the entire programs committee. We are hopeful that we are going to be able to gather in person for the HPHA annual meeting in the fall. So stay tuned for details on that. We don't have a time, a date, or location at this point, but like I said, we're hopeful that we'll be able to gather in person again. So again, I'd like to say thank you to all of you that joined us today. As you close out Zoom, you will be given a link to an evaluation. So we would really appreciate some feedback for you. If you don't get that link, it will also be sent to you via email, but any feedback is always welcome. Mahalo for joining us today. Amanda just dropped the link into the chat box too. So if you want to click on that, it'll take you to our evaluation. But again, mahalo for joining us today. I hope you have a wonderful evening, and we hope to see you all in the fall for our annual meeting. Aloha.